So starting with today's lecture, in today's lecture we are going to discuss about homeopathic aggravation. This is one of the topic from Kant's philosophy also. But in today's lecture, first we will see what is mean by homeopathic aggravation in general. Means when only homeopathic aggravation asked to you in exam, that is what to write about the homeopathic aggravation. And along with this, we are also going to discuss about the disease aggravation and the medicinal aggravation. So in this lecture we are going to discuss what is mean by homeopathic aggravation, what is mean by disease aggravation, and what is mean by medicinal aggravation. So these three types of aggravation we are going to discuss in today's topic. So in this we started with the topic of homeopathic aggravation. So prior to this, anyone can tell me about what do you know about homeopathic aggravation? Anyone wants to tell what is mean by homeopathic aggravation? In which aphorisms it is discussed by Dr. Hanuman? Yes. So it's okay. Yes, that is the remedy reaction. Yes. In this remedy reaction, they also explain about the homeopathic aggravation, but mainly it is discussed from aphorism number 154 to 161. In these aphorisms, the homeopathic aggravation, this term is explained in different aphorisms. And in aphorism number 248, in 6th edition of Organon, they also explain about the homeopathic aggravation. So it is explained by Dr. Hahnemann from aphorism number 154 to 161 also. And in this, what is mean by homeopathic aggravation? So it means that is homeopathic aggravation is the short, sharp aggravation of the existing symptoms of the patient after the administration of a well selected medicine. That is when we selected a medicine for a patient, that is the homeopathic medicine, and after this there is a short and sharp aggravation of the existing symptom of a patient, that we call it as a homeopathic aggravation. So in this you have to remember that the homeopathic aggravation means it is the sharp and short aggravation of existing symptoms of the patient. What are the symptoms present in a patient that gets aggravated, that we call it as a homeopathic aggravation. And what is mean by medicinal aggravation? So it is the aggravation or there is the appearance of a new group of symptoms that are related to the medicine, that we call it as a medicinal aggravation. And disease aggravation, it is the uh, aggravation of the disease symptoms, that we call it as a disease aggravation. So in this, while remembering homeopathic aggravation, you have to remember that the homeopathic aggravation is the short, sharp aggravation of the existing symptoms. That existing symptoms have importance. That is, what are the symptoms present in the patients that get aggravated, and after the administration of a well selected medicine, that we call it as a homeopathic aggravation. So according to aphorism number 26, it is an essential phenomenon in the process of homeopathic cure. By this aggravation, the artificially produced disease force exhibits its dominancy and supremacy over the identical natural disease force. So according to the aphorism number 26, that is therapeutic law of nature, in this it is told that the weaker dynamic affection is permanently extinguished by the stronger one, with a slight aggravation or the what the force we used, it slightly higher than the existing symptoms. So in this, it is essential phenomena in the process of homeopathic cure. And by this aggravation, the artificially produced disease force exhibits its dominancy and the supremacy over the identical natural disease force. And subsequently, the weaker disease force is extinguished from the organism. Due to this, the weaker disease force is extinguished from the organism by the later stronger one. That the stronger one affects the weaker, so it annihilate the weaker, which is in the similar way. Then thereafter, according to aphorism number 29, the stronger medicinal disease force becomes gradually muffled from the organism due to the minuteness of the dose, and that stronger force also gets annihilated due to the minuteness of that dose. That is explained by Dr. Honeyman in aphorism number 29. So that is the homeopathic aggravation. We call it as a homeopathic aggravation is a short, sharp aggravation of the existing symptoms of the patient after the administration of a well selected medicine. That we call it as a homeopathic aggravation. Now there is a mechanism of aggravation, how the aggravation is formed. So in this, the administration of a minute dose of an indicated medicine may cause slight aggravation of the existing individual symptoms, because the administration of a minute dose of an indicated medicine may cause a slight aggravation of the existing individual symptoms. Why this is caused? So this is caused because the homeopathic medicinal potentiality is always greater than the natural disease potentiality. So it is according to the aphorism number 26, that is what the medicine we used, it is slightly higher than the natural disease force. Then second, we can regulate the potency and dose of the medicine. So the potency and the dose of medicine is in our hand, that is how to manage it. Then medicinal potentiality acts unconditionally, that is at all times, under any circumstances, and upon all the persons. That is, what is the medicinal potentiality has? It acts in unconditionally, that is at all the times, under any circumstances, and upon all the persons. So it is homeopathic medicine acts in an unconditionally way, that is in all circumstances, in all persons. And similarity between two morbid pictures in their individual planes, and there is a similarity between these two morbid pictures. When there is a dissimilarity between these two morbid pictures, there is not the formation of cure. These disease condition not cured if these are the dissimilarity present between these two morbid pictures, but there is a similarity that causes the cure, and it is slightly higher than the natural disease, hence it produces a slight homeopathic aggravation, and it is a good sign. So this aggravation is quite natural. Such aggravation is good thing which directs us to a conclusion that the treatment is going on the right track. So what is this homeopathic aggravation? It is a good thing which directs us to the conclusion that the treatment is going on the right track. The treatment is going on the right track. It is an indication of that homeopathic aggravation. And a patient who is experiencing a pure homeopathic aggravation feels good in general in spite of aggravation, but this is not so if it is a medicinal aggravation. That is, there is a feeling of well-being or a welfare in the homeopathic aggravation. That is, instead of increasing the symptoms of patient, there is a feeling of well-being that is present in homeopathic aggravation, but in medicinal aggravation there is no any feeling of well-being present in a patient. So if the potency is sensibly adjusted, or if the repetition is not too frequent, then cure is achieved even without any appreciable primary aggravation. So if the potency is sensibly adjusted, or if the repetition is not too frequent, then cure is achieved even without any appreciable primary aggravation, and this is possible as homeopathic medicines are given after maintaining the basic principles of homeopathy, especially the law of potentization and the law of minimum. So, if the potency is adjusted, if the repetition is not too frequent, cure is achieved without any appreciable primary aggravation. That is, if we give the medicine to the patient, in that case, it can be cured without any primary aggravation if we follow the law of potentization and the law of minimum. The law of potentization is we have to convert the crude form of medicine into the dynamic form of medicine, in which we decrease the quantity of the medicine and we increase the quality of that medicine. And in law of minimum we have to use the very um, minimum quantity of dose to that patient to activate or stimulate the vital force of that human being. So, in spite of such applied precautions, if aggravation must come, it is negligible and transient. And with the following these law of potentization and law of minimum, if aggravation comes in a patient, these are very negligible and a transient aggravation, and cure is effected before the appearance of any external manifestation of the aggravation. And due to these following of law, that is of law of potentization of law of minimum, we can bring a cure in a patient without any aggravation. A minute dose of homeopathic medicine will not result in any aggravation in a patient unless he is idiosyncratic. That is, if we use only the minute doses of medicine to treat the patient, in that case, homeopathic aggravation can be avoided, and this can be seen only in a patient who are idiosyncratic. And you know that the idiosyncratic patient is having the peculiar corporeal constitution which is oversensitive to certain things that brings in them the proving of each and every medicine. So this is the mechanism of homeopathic aggravation. Firstly, we study about the what is mean by homeopathic aggravation, and it is based on the law of 26, that is the therapeutic law of nature, aphorism number 26. Then we study about the what is the mechanism of formation of homeopathic aggravation. That is, as you know that you give the medicine in a slight higher potency or in a higher form, that may produce a homeopathic aggravation in patient to remove the natural weaker disease condition. Then there are some aggravation in the light of organon. That is the what are the different points that are given in organon of medicine. That is, this aggravation depends upon the nature of the disease. Hahnemann says in aphorism number 161, that is, the aggravation depends upon the nature of disease. What is the nature of disease on which the aggravation depends? It is explained by Dr. Hahnemann in aphorism number 161, and in this he explained about the acute diseases and diseases of recent origin. Homeopathic aggravation is limited to first few hours. That is, the homeopathic aggravation and a disease condition it have explained about, that is in acute disease conditions or diseases of recent origin, homeopathic aggravation is limited to first few hours. Means in homeopathic aggravation in acute diseases we will see in only first few hours. Then homeopathic aggravation is observed during the first 6, 8, 10 days with amelioration of whole disease condition. This is given in fifth edition of Organon of Medicine, that is regarding the chronic diseases. That is, homeopathic aggravation is observed during the first 6 days, 8 days or 10 days with the amelioration of whole disease condition. But in sixth edition, Hahnemann observed that such increase of original symptoms of chronic disease can appear only at the end of a treatment when the disease is almost of quite finished. It is explaining in aphorism number 248. So, according to Dr. Hahnemann, in homeopathic aggravation in acute disease condition and in chronic disease condition. So homeopathic aggravation in acute disease condition can occur in first few hours in acute disease condition. But what is in chronic disease condition? In chronic disease condition, the Hahnemann put two regards in fifth edition and in sixth edition. So what is his thinking about the homeopathic aggravation in fifth edition? That is homeopathic aggravation in chronic diseases observed during the sixth day, eighth day, 10th day, 12th day, etc. When with the amelioration of whole disease condition. This is explaining in fifth edition of Organon of Medicine regarding the aggravation in chronic diseases. But what is the view of Dr. Hahnemann in sixth edition of Organon of Medicine? That is, but in the sixth edition, Hahnemann observed that such increase of original symptom of chronic disease can appear only at the end of a treatment when the disease is almost of quite finished. And you know that when the chronic disease is going to cure at the end of a treatment, you find that there is an aggravation of symptom of a disease condition or a patient in a chronic disease condition at the end of a treatment, or where there is an end of a treatment when the disease is almost quite finished. At that time there is an appearance of aggravation in chronic diseases. It is explained in aphorism number 248 and in the sixth edition of Organon of Medicine. So, this is regarding the difference between the fifth and sixth edition of Organon regarding the homeopathic aggravation of chronic diseases. Then, what is the significance of homeopathic aggravation? That is, homeopathic aggravation indicates the following, that is, an approaching cure, life principle now free from natural disease force, then revelation of Herring's law cure, and good prognosis is possible and correct second prescription can be made. So what is the significance of homeopathic aggravation? So significance of homeopathic aggravation, it is according to the aphorism number 280, and what it gives, that is, what is the homeopathic aggravation, and it having a significance of an approaching cure. That is, when you find that there is a homeopathic aggravation in a case, the patient is approaching to the cure. It is the first significance. That is, you think that our patient is on a right track and he is going to cure. Then the second significance is that life principle now free from the natural disease force. That is, you know that the life principle is affected due to the natural disease, and when you find that there is a homeopathic aggravation in a case, you may say that the life principle now free from the natural disease, and it is on now on the effect of a artificial disease force, and that artificial disease force has fixed duration of action, and after this the artificial disease force also gets removed, and the life principle now free from both artificial and the natural disease force, and he is on the track of cure. Then next significance is relevation of Herring's law cure. That is, you think that, or it is a sign that Herring's law cure is going on a right track. That is, it is go from above downward, from within outward in the reverse order of their appearance. When you find the homeopathic aggravation, you may think that your case is on the right track and it follows the Herring's law cure. And next significance is that the good prognosis is possible and correct second prescription can be made. So when there is a appearance of homeopathic aggravation, it is a good prognosis is possible of the case, and you have to give the correct second prescription to that case. So these are the different significance of homeopathic aggravation. That is, an approaching cure, life principle now free from natural disease force, relevation revelation of Herring's law of cure, and good prognosis is possible and correct second prescription can be made. So this is the significance of homeopathic aggravation. So up till now we studied about what is mean by homeopathic aggravation, Then secondly, what is the mechanism of homeopathic aggravation? Thirdly, we studied about, that is, uh, homeopathic aggravation and the organon. That is, what is homeopathic aggravation in acute condition and what is in chronic condition, according to the fifth edition and according to the sixth edition of Organon of Medicine. Now there is an interpretation of aggravation. That is, when aggravation comes in a patient, what is its interpretation? This is the next point, that is the interpretation of homeopathic aggravation. So in this, the first interpretation is that if the aggravation is long with decline of the patient's strength, the case is incurable and can only be palliated. That is, if in a case you find that if the aggravation is long, there is a long aggravation with decline of the patient's strength, that in that case you may interpret that the case is incurable and can only be palliated. As there is a long aggravation with decline of the patient, it means the disease is incurable and you can only way to palliate the disease condition and not to cure the disease condition, as it is an incurable disease. So this is the first interpretation of aggravation. Then second interpretation is that if the aggravation is long with a slow improvement, it is a borderline case. Prognosis is good if the remedy is not too soon repeated. So what is the second interpretation? That is, if the aggravation is long with a slow improvement, aggravation having a long duration of period, but along with this, in this there is a presence of slow improvement. So in that case, it is a borderline case and you may say that the prognosis is good if the remedy is not too soon repeated. That is, you have to wait and watch till the action of the medicine completed and you do not repeat that medicine again and again. So in that case, the prognosis may be the good prognosis if there is a long aggravation with slow improvement. Then the third interpretation is that if the aggravation is short and simple, the patient has enough vitality and the best result will follow. So if you find the aggravation is short and simple, in that case your remedy is acting and your vitality is good, that is the patient's vitality is good, and the best result will be follow after this. So this is the third interpretation, that is aggravation is short and simple. Then next is if the quality and quantity of the remedy administered are in exact proportion to the quality and quantity of the disease force, there will be an ideal cure without aggravation. That is, if the quality and quantity of the remedy administered are in exact proportion to the quality and quantity of the disease condition or the natural disease force. In that case, there will be an ideal cure without aggravation. So, in that case, you will not find any aggravation and there is a ideal cure occur in a patient. Then next is a, if there is an immediate amelioration soon by aggravation, followed soon by aggravation, that we call it as a homeopathic aggravation. So it is a fifth interpretation of homeopathic aggravation, that if there is an immediate and immediate amelioration followed by soon aggravation, in that case you may tell that the case is incurable. Means first amelioration comes and followed it by a soon aggravation, the case is incurable. Then in sixth interpretation it is told that if too short an amelioration follow an pronounced aggravation, so in that case you also told that it will prove incurable and especially in a psoric case. So this is the next interpretation, that is amelioration is too short an amelioration but followed by a pronounced aggravation. So these are the different Kent's 12 observations, that is Kent explained about the aggravation and the amelioration, and in that case we are dealing with that interpretation of aggravation. If aggravation comes in a patient, what are the different conditions? As aggravation comes first, amelioration comes afterwards, or amelioration comes first then aggravation comes. These are different interpretation. Now the next interpretation is that if a full-time amelioration of symptoms occurs without any increase in the patient's strength, that we call it as a, that results in a vitality too weak for a restoration of health. That is, if a full-time amelioration of symptoms occurs without any increase in a patient's strength, the vitality is too weak for a restoration of health, means there is no improvement in a patient but only the amelioration without any improvement in a patient. This is the next observation of Kent also, and the interpretation of aggravation. In that case, the vitality of a patient is weak, that is required for the restoration of health. Then the next interpretation is that if the patient develops symptoms of the remedy given without improvement in his disease symptoms, that is, if the patient develops symptoms of a remedy given without improvement in his disease symptoms, the case is a hard one to treat as he is very sensitive to all remedies, virtually proving them. So, in that case, the case is hard one to treat and he is very sensitive to all remedies, virtually proving them. This is the next interpretation. Then the next interpretation is that if old symptoms appear with the aggravation, one has to wait the most suitable remedy has been administered. So in that case, if the old symptoms appears with the aggravation, in that case one has to wait the most suitable remedy has been administered. So these are the different interpretation regarding the homeopathic aggravation. So this is the explanation about the homeopathic aggravation. So in that case, homeopathic aggravation, it is the short and simple aggravation of the existing symptom of a patient after the application of a well selected medicine on a miasmatic basis, that will result in a homeopathic aggravation, and it is a beneficial phenomena in the process of homeopathic cure. By this aggravation, the artificially produced disease force exhibits its dominancy over the natural disease force to extinguish it from the organism, and this we call it as a homeopathic aggravation. Then after that we studied about what is the mechanism of homeopathic aggravation. After this we studied about what is the homeopathic aggravation in acute condition and what is in chronic condition. In chronic condition also what is in fifth edition and what is in sixth edition. Then we studied about the significance of homeopathic aggravation, and after this we studied about the interpretation of homeopathic aggravation. Now there is a difference between homeopathic aggravation, medicinal aggravation and a disease aggravation, and you have to remember that in many of the exams they will ask about you, that is what is the difference between medicinal aggravation and the disease aggravation, or what is the difference between homeopathic aggravation and the medicinal aggravation. So these three differences we have to take note of it, that is the comparison between the homeopathic aggravation, medicinal aggravation and the disease aggravation. So in this we are going to discuss the different point regarding the comparison between these three aggravation. So in this, the first point of difference is the definition. Now we will see about what is the definition of homeopathic aggravation, medicinal aggravation and the disease aggravation. So first, the definition of homeopathic aggravation. So what is the definition of homeopathic aggravation? It is the short, sharp aggravation of the existing symptom of a patient after the application of a well selected medicine. That is, it is the aggravation of existing symptoms of a patient after the application of a well selected medicine, that we call it as a homeopathic aggravation. Then the definition of medicinal aggravation. So what is the definition of medicinal aggravation? That is, after the application of homeopathic medicine, new symptoms appear in addition to the existing suffering of the patient. This condition is called as a medicinal aggravation. So you have to remember that in medicinal aggravation, it is occurred after the application of homeopathic medicine. A new symptom appear in addition to the existing symptom of the patient. That is, already patient is suffering from existing symptoms, but there is an appearance of new group of symptoms, and mainly it is related to the medicine. So this condition is called as a medicinal aggravation. Now the third one is the disease aggravation. So what is mean by disease aggravation? The disease will go on progressing following its own course despite application of medicine. That is, you are prescribed the medicine to the patient, but despite of this, the disease will go on progressing. That is, pathological changes occur in that disease condition, and disease will progress and progress following its own course. That is, it follow its own course despite application of a medicine. That we call it as a disease aggravation. So you have to remember the main definition of these three aggravation: homeopathic aggravation, medicinal aggravation, and the disease aggravation. Now the second point of difference is what is the feeling in homeopathic aggravation, what is the feeling in medicinal aggravation, and what is the feeling in disease aggravation. So second point of comparison is feeling. So in this, in homeopathic aggravation, there is a feeling of general well-being in spite of aggravation of symptoms. There is a feeling of general well-being in spite of aggravation of symptoms in homeopathic aggravation. Then in medicinal aggravation, there is a feeling of totally, that is feeling of well-being is totally absent in medicinal aggravation. The feeling of well-being present in homeopathic aggravation, feeling of well-being is totally absent in medicinal aggravation. And in disease aggravation, the patient feels worse both physically and mentally also. That is, the patient feels worse both physically and mentally also in disease aggravation. So this is the second point of difference, that is the feeling. Now the third point of comparison is the nature, that is, what is the nature of homeopathic aggravation, what is the nature of medicinal aggravation, and what is the nature of disease aggravation. So in nature, we will see that in homeopathic aggravation, here only increase of existing symptoms takes place, sometimes appearance of suppressed symptoms. That is, in nature, in homeopathic aggravation, we will see that there is increase in existing symptoms of a patient, and along with this, the symptoms which are suppressed, they also appeared in homeopathic aggravation. So this is the nature of homeopathic aggravation. Now what is the nature of medicinal aggravation? So in nature of medicinal aggravation, if only few symptoms appear, they automatically subside, but if many symptoms appear, it should be treated accordingly. That is, if only few symptoms appear, they automatically subside, but if many symptoms appear, they should be treated accordingly. That is, in that case, in medicinal aggravation, if there are only few symptoms, these symptoms gets automatically subside. But if you find a number of medicinal symptoms or medicinal aggravation in the patient, you have to treat or select a remedy accordingly. Then what is the nature of disease aggravation? In this, the patient's condition deteriorates in all aspects. So in that condition where disease condition occur, their patients deteriorates in all the respects of a healthy condition. So this is the nature of disease aggravation. Now the fourth point of comparison is indication. What is the indication of homeopathic aggravation? What is the indication of medicinal aggravation? And what is the indication of disease aggravation? So indication of homeopathic aggravation is that the indicated medicine is similimum to the case, or the medicine administered is the similimum when you find the homeopathic aggravation. Then what is the indication of medicinal aggravation? In that case, the medicine is absolutely correct. And what is the disease aggravation? In that case, a wrong selection of medicine, or the disease is incurable. That is, if there is a disease aggravation, you will find that there is a wrong selection of medicine and disease is incurable. So this is the indication of homeopathic aggravation, medicinal aggravation, and the disease aggravation. Now the next point of differentiation is the second prescription. That is, what will be the second prescription in these aggravations. So in second prescription in homeopathic aggravation is, second prescription will not be necessary. Yes, can I audible? Yes, can I audible?
Yes, ma'am.
Okay. So we are discussing about the difference between the homeopathic aggravation, medicinal aggravation, and the disease aggravation. So we discussed the point about the definition of homeopathic aggravation, medicinal aggravation, and the disease aggravation. The second point is feeling. Then third point is nature. Then fourth point is indication. Now fifth point is second prescription. What will be the second prescription in homeopathic aggravation, in medicinal aggravation, and in disease aggravation? So homeopathic aggravation, the second prescription will not be necessary, as there may be the cure of a patient due to that homeopathic aggravation, or the case is curable, or we select the correct medicine in that case. So many of the time the second prescription will not be necessary in case of homeopathic aggravation. But in medicinal aggravation, the second prescription will be an antidote. The method of antidoting depends on the severity of medicinal aggravation, that is, whether complementary antidote or elimination antidote. That is, what is the severity of medicinal symptoms, that is, how the severe the medicinal aggravation present in a patient. Accordingly, we have to use the antidote as a second prescription in medicinal aggravation. Then in a disease aggravation, what should be the second prescription? That is, you have to fresh case taking must be made in that case, and new medicine is selected for the disease condition. So this is the second prescription for the disease aggravation. And now the last point is regarding the prognosis. What will be the prognosis of homeopathic aggravation, medicinal aggravation, and the disease aggravation? So in that, the prognosis is very good in homeopathic aggravation, it is bad in a medicinal aggravation, and it is very bad in a disease aggravation. So homeopathic aggravation are the good sign, but medicinal aggravation and the disease aggravation are the bad sign that appears in a patient. So this is the comparison between homeopathic aggravation, medicinal aggravation, and disease aggravation. And you have to remember about this comparison, as in many of the exams they will ask you about the difference between these three aggravations. So in this way we finished what is mean by general aggravation. So in that, you have to remember the definition of homeopathic aggravation, then on which basis it is based, then what is the mechanism, then what is the homeopathic aggravation in acute condition and in chronic condition, in chronic condition also in fifth edition and in a sixth edition. Then you have to explain about the significance of homeopathic aggravation, and lastly the interpretation of homeopathic aggravation. And lastly, we studied about the comparison between homeopathic aggravation, medicinal aggravation, and the disease aggravation. So in this way we finished the medicinal aggravation, homeopathic aggravation in general. In tomorrow's lecture we will see what is the concept of Dr. Kent, which he explained in chapter number 34 in homeopathic aggravation. So we will see tomorrow the homeopathic aggravation according to Dr. Kent. So all of you understand, or anyone having any difficulty regarding it? It is very simple, that is the homeopathic aggravation. Yes, all of you understand?
Oh, ma'am.
Okay. So we will stop here, and in tomorrow's lecture we will see the concept of Dr. Kent. So bye everyone.